So we're going to call the meeting to order. So I'll read everyone can hear me, correct? David, you can hear me? Okay. Lorenzo?
Yes, I can.
Okay. Pursuant to Chapter 2 of the Acts of 2023 enacted relative to extending certain COVID-19 measures adopted during the state of emergency signed into law on March 29th, 2023, this meeting will be conducted via remote means and in person, as long as members of the public can easily access the proceedings in real time and participate remotely. Until further notice, this meeting will no longer be broadcast live, but it may be watched when the show is replayed on YouTube. Members of the public who wish to participate in the meeting may do so in the following manner. In person at the Roquois Meeting Room located on the second floor at Plymouth Town Hall, 26 Court Street, Plymouth, Mass. Note that the occupancy limit of the room may reduce the number of attendees that can be accommodated. For remote access, just use the link and the passwords on the agenda. You may also send any comments or questions that pertain to a current agenda item to publichealth@plymouth-ma.gov. They'll be read on the air and answered by the Board of Health as practical. If time doesn't permit answers during the meeting, responses will be sent by email as soon as possible. So welcome to the meeting of the Board of Health on Wednesday, April 24th. Our first agenda item is to approve the revised minutes from the 27th of March. Does anyone have any other changes to those minutes? I see people shaking their heads no. In that case, I just need a member of the board to make a motion to approve the minutes as revised.
I send them.
Dr. Reed makes the motion. Is there a second?
I can second that.
Amy seconds the motion. If there's no further discussion, I'm assuming not, I will call the roll. So Dr. Reed, yes or no?
Yes.
David Golden, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Deb, I think you were present for that one, if I remember correctly.
I was, yes,
Okay, so yes or no?
yes.
And myself, yes, so it's unanimous. The minutes from the 27th of March are unanimously approved. Next item of business, I have to screen share. This is always a lot of fun trying to do this. So let's see which is which here. It's this. And go to slideshow. Okay, can everyone see this slide? Deb, can you see that?
Yes, I can. Yep.
Yes.
Okay, and I assume everyone can. So at the previous meeting, I mentioned that we had a request that the Board of Health support State Bill 2685 for the current state legislature. And so far, I'll just run through it a little bit. I did send it to everybody so they could read it. It's an act relative to monitoring dry casks of spent nuclear fuel. It went before the Joint Committee on Public Health. And as you can see, it was reported out favorably. And now it is currently in the Senate Ways and Means Committee. And this is a current topic that's going on a lot at the NDCAP meetings. So that's the current status of the bill. If anyone has any questions about it, I could attempt to answer it, but if you've had a look at it, I just need to know if the Board of Health would like to support this particular bill at the Senate. So I'll just ask individuals. Amy,
Yes, I'd like to support
you'd
it.
like to? Dr. Reed?
Absolutely.
Okay. Lorenzo, would you like to support that as well?
Yes, I would like to join this caucus in supporting this.
Okay, and David?
Yeah, I just have a quick question, Barry. Are we talking about sending a letter of support in?
Well, there's two ways to do it. I was asked by someone who was involved with this, to let them know if the Board of Health votes to support it, so that they can send a message into the Ways and Means Committee that, the Board of Health in Plymouth has voted unanimously to support, this particular bill that's pending. We can also, of course, contact our local representatives and senator, and ask them also to co-sponsor the bill as it moves through the legislative process. But, I usually do that, just because I do. And, usually I immediately get responses from at least some of the representatives and senator that say, I thank for bringing it to my attention. We'll certainly support this as it goes through the legislative process.
Yeah.
But it helps to have co-sponsors, and some of them actually will co-sponsor it.
Yeah, I would be, I read through the bill and I'm in favor of it. I wonder if it would be helpful to give a brief overview for the folks at home or in the audience there, so they know what we're talking about when we say we support.
Okay, well, it's gonna come up a little later on, in the agenda when I start talking about the nuclear power plant decommissioning and the SOS film trailer and the
Okay.
Pilgrim nuclear plant update.
Perfect.
Because there's some graphic representations about what's going on.
Yep.
And I think that will probably answer the questions for anyone who might be watching,
Works for me.
okay?
Yep, thank you.
Okay, so I don't think we need to take a formal vote. I will just communicate to the sponsors of the bill that Board of Health has voted to support it also. Next item of business is going to be,
Point of order, Barry.
okay,
I do think we ought to take a formal vote.
okay,
Just, if we're to say that the Board of Health supports it, I think there needs to be a record of that. And the only way to record it truly is through an affirmative.
okay, we can do that, sure. Would someone like to make that motion?
I'll make a motion to support the bill that
Okay,
you mentioned.
that's
Remember it?
that's Senate Bill S-2685.
Yes.
Okay, is there a second? Okay, is there further discussion? Hearing none, I will once again just call the roll. Dr. Reed, yes or no?
Yes.
David, yes or no?
Yes.
Lorenzo, yes or no?
Yes.
Amy,
Yes.
myself, yes, it's unanimous. So we dotted the i's and crossed the t's, David, at your suggestion. Next thing that's coming up is going to be, some state tobacco statistics, which I discovered, which I thought were quite interesting. So this comes from a company that's heavily involved in this kind of work. And you can see on those figures that are being shown at the bottom, that they're comparing cigarette use in Massachusetts among both adults and high school students. And fortunately for us, among adults, we're lower than the state average for cigarette use. And for high school students, it's close to the same. If you look at other tobacco product use, it's not quite as reassuring. Because if you look at adult e-cigarette use, it's 5.4%. For smokeless tobacco, which is basically chewing tobacco, it's 2.2%. But among high school students in Massachusetts, it's 17.2%. This was as of 2021. I'm hoping that this has gotten better in the 3 years or 2.5 years since then. But obviously e-cigarette use in the schools is still a major issue that's causing probably people to get addicted to nicotine. In terms of 2023 tobacco taxes, again, Massachusetts is way up there in terms of the level of taxes that are assessed against packages of cigarettes. $3.51, whereas the US average is $1.93.
So there, I read an article, it was like Ohio, like eastern Ohio, western Pennsylvania, and Pennsylvania, I think, had higher taxes.
Mhm.
And you could see the amount, like, everything else was the same, and the state with the higher taxes had less people smoking.
Yeah, I
It
mean,
was very, yeah, it was like one of those, like, everything else is the same.
Yeah. this website, actually, you can look at any state
Mhm.
and see if you have a lot of patients and you want to go through all states.
Yeah, yeah.
You can see what the smoking rate is, and it's pretty obvious that, there's a much worse problem, especially in the southern states and the states that have had tobacco for a long, long time, because they grow it there.
Mhm, mhm.
But, there's more. These are nicotine pouches. Remember I mentioned before that there was nicotine infused toothpicks? That, I think Dr. Reed brought that up.
Mhm.
But there's also these nicotine pouches, and what happens with these is that they put a pouch underneath the tongue. And it stays there, and the nicotine sort of diffuses out into the circulatory system. And if you notice this, there's like 3 brands mentioned: Zyn, On, and Vito. The products gained popularity in recent years. Overall sales of nicotine pouches have increased from 126 million units in 2019 to 808 million units in 2022. During the period, sales of nicotine pouch products containing a higher concentration of nicotine, which is like 8 milligrams, increased more rapidly than products with lower nicotine concentrations, which is defined as around 4 to 6 milligrams. And Altria, I guess, has announced that to its investors, they're introducing a new version of its On nicotine pouch product that has a higher concentration of nicotine than their current products. So they're not being good citizens, but of course, it's their business model and they want people to get a lot of nicotine.
Those can't be sold in the town of Plymouth.
They're not able to be sold at all.
Really? How come?
They're flavored.
Oh, okay.
Yeah.
Okay.
Yeah, you might notice these have spearmint and peppermint flavor.
Mhm.
They
And
have
that's,
non-flavored though,
They do, and
but no, you're
we've,
right.
we've gone back and forth with a few of our
Oh,
vendors about that particular product. Mhm.
so they can't be sold in Massachusetts at all?
No, not the flavored ones,
Yeah,
can't,
yeah,
no.
but in other states, they obviously are,
yeah,
so.
yeah.
Oh.
I know Rhode Island does not allow it. Does New Hampshire allow?
I think
it?
Connecticut does.
Yeah, I was surprised about Rhode Island.
Yeah, I think Connecticut does.
So among the school students, the problem is that if they put this under their tongues and they bought it in, say, another state where it was legal to have it, then they're sitting in classes and they are, obviously getting infused with nicotine into their circulatory system, which
Yeah.
is
Well,
probably,
yeah, those exist non-flavored and they're sold in
Yeah.
Massachusetts. So, I mean, they can even,
yeah,
Kids get
they
that.
could, but as we found out with the e-cigarettes, usually the flavored products are the ones that the school students are most attracted to.
interesting.
Yeah, they're not interested in the unflavored one.
Unless you particularly like the flavor of
Well,
tobacco.
Yeah.
Probably not. So in addition to that, they also mentioned that there's a lot of clean indoor air ordinances.
Mm.
So in many states, smoking is prohibited in all government workplaces, private workplaces, schools, childcare facilities, restaurants, bars, with the exception of smoking bars, retail stores, and recreational cultural facilities. I was trying to remember when I saw that. Did we make an exception for smoking bars?
We didn't.
We didn't. So,
No, we do not allow smoking bars in Plymouth.
But in smoking bars.
We don't allow them.
We don't,
Only if you are a private, nonprofit organization can you have any type of smoking inside your facility.
I'm sorry, do our regulations restrict smoking bars? Like the actual smoking bar?
Yeah.
Like, oh, okay, all right, I thought we didn't, but,
We did.
okay.
yeah, vape shops and things like that. And
Oh,
they still
you can't-
offer it
You can sell it, you
Yeah.
can't vape inside of
inside
it.
of it. Yeah.
Like, say the Brennan's, you can buy tobacco products there, but you can't smoke inside of it.
Mhm, mhm.
But there are still a couple of private clubs
Mhm.
in Plymouth classified as, nonprofit, private clubs who can do that inside of their property if they wish.
And one is nearby and they seem to enjoy smoking cigars.
They do.
But I won't mention the name. So here's some quitting statistics. CDC has estimated 44.8% of daily adult smokers in the state quit smoking for at least one or more days, and that was done in 2019. In 2014, the Affordable Care Act required Medicaid programs to cover all tobacco cessation medications. Massachusetts State Quit Line invests $1.38 per smoker, compared to the national average median of $2.37. That sort of surprised me.
Well, that's why we get bad grades.
Yeah,
You know, when they do the national grading system, we get an A for the amount of tax that we collect. We get an F for the amount of the tax that we collect that actually goes back to helping stop smoking.
yeah,
So there it is, right there.
but that's not us, that's the state.
It's not us. Oh, no, no, it's definitely not us. It's but Massachusetts. That's why we don't do well in that category.
And that's why they get upset about violations of sales to underage buyers, because we keep getting threatened in this state by the federal government to loss of funds because we don't meet the federal criteria for things like this.
You know, it's interesting when you say like, they quit smoking for one or more days in 2019. I remember that they used to have a really big campaign about, like, I don't know if they called it smoke out or something like that, where everyone was supposed to quit for like one day. But I don't remember seeing anything like that recently, like since COVID. I don't think I've seen anything like
I
that.
haven't seen it either.
We should try to do that for Plymouth. We should try to have one.
That seems like a good thing for the Board of Health and the department to sponsor.
I think that'd be so cool. Let's think about that.
We should
Make a note in a minute.
I think it'd be really cool.
And we should distribute, like smoking quitting aids.
Yes, I think it's a great idea. I'll work on
I was at a store today that had a violation, they had to pack all up on it, and people coming in to buy cigarettes. And they're like, sorry, we can't sell for 7 days, and the person would leave, say, I'm gonna try not to smoke for 7 days.
that.
Like, two people. heard that.
Wow.
So, I mean, fingers crossed that they don't go to another place, but.
Lorenzo had his hand up too, just so you know.
Yeah,
Mhm.
That's fantastic, Amy.
well, violation.
No, I meant that, but
Yeah.
instead of saying, I'm gonna go down to another town,
Exactly.
they said, well, I'm gonna take this opportunity.
Yes.
I mean, that's the
it.
right direction.
Yeah, I mean, people know it's not good for them.
Yeah, so that's.
So, yeah.
But
Pretty
it's
cool.
massively addictive and it's very hard to quit.
Yeah.
Mhm.
Okay, Lorenzo, someone noticed you have raised your, video hand?
Yes, I did. When, a great discussion through the chair. I think from a policy standpoint, as a Board of Health, we're cognizant of tobacco use and things like that. And, most recently we made some board action to reduce the amount of licenses, right? So that's good. But I wanted to ask my fellow board members about if you guys were aware of like the Brookline's smokeless generation regulation, right? You added, and that went through the Supreme Court in Massachusetts and said that it was fine to do that kind of action. I just wanted to get the kind of a pulse of what you guys think.
That's coming up in a moment.
Stay tuned.
Because I also am aware of that. So funny that you should mention that, Lorenzo. Brookline prohibits the sale of tobacco or e-cigarette products to anyone born after January 1, 2000. Before the court ruling, and this went to the state Supreme Court, Brookline's generational ban on tobacco sales was an oddity, but and this came out of, I guess, today's or yesterday's Boston Globe. But the rule banning the sale of tobacco and e-cigarettes to most, if not all, people from this century has been proliferating. In Massachusetts, turning the state into ground zero for a novel effort to go beyond setting a minimum age to combat tobacco use. Officials in about a half a dozen greater Boston communities either passed bans or began considering them weeks after the Supreme Judicial Court upheld Brookline's own groundbreaking bylaw. So make a note, this was done as a bylaw. That banned the sale of tobacco and e-cigarettes to anyone born on or after January 1, 2000. In Wakefield, Stoneham, and Melrose, they've already approved their own versions of the ban, and Winchester and Malden are holding public hearings in the coming days on their proposals. Reading and Medford would probably fall within another month. So, of course, you hear from other people, but each municipality held a public hearing last fall, and in recent weeks adopted identical regulations that are going to take effect in January 2025. Ban the sale of tobacco e-cigarette products to anyone born or after January 1, 2004. So anyone not 21 at that time, when it takes effect, would never be able to legally purchase any tobacco products in those towns. So the kind of thing that they need to do, and this again is better if it's on a state level, is all municipalities have to conform. And just because it's too easy to cross borders, and we've talked about this many times. So say if they lived in one of the towns that has this generational ban, so they go to Waltham or Needham or Watertown to buy the cigarettes and the tobacco products.
But if you look at it historically, that's exactly where we're at now. Like the 18 to 21 was starting this way. Like 21, what? Everybody's gonna go next door. And even the flavored vape was the same. Like everybody's gonna go next door. So I'm curious to see if this takes off the way, and even smoking in restaurants, that was town by town until the state finally jumped on. Cause I don't think the state will do this at all until the majority of towns. And I don't know if it would ever get to the majority of towns. It's
Yeah.
definitely controversial right now.
Yeah, you'll see in a minute why it's so controversial, and guess who opposes it? So it's the New England Convenience Store and Energy Marketers Association. So their statement is these local board of health are working with proponents ahead of time, and then they have a hearing for show. It's essentially a rubber stamp by the time it gets to the public hearing, according to Peter Brennan, executive director of this trade organization representing 7,000 retailers, and they've opposed and tracked similar regulations across the state. So again.
What's the tracker? Like they've been tracking it, but it keeps moving to be more restrictive around smoking, you know, so I'm curious to see.
Peter Brennan actually attended one of our Board of Health meetings when we were first talking about, when we unsuccessfully tried to raise the age to 21.
When was that?
This is in the Old Town Hall, probably maybe 8 or 9 years ago. No, but he came.
Yeah, before any of our time, but.
It was,
Yeah.
oh yeah, it was way before.
So the
that.
board voted to keep it at 18.
Yeah. Well, it was interesting, to be honest with you. The day that it happened, there were only 3 people out of the 5 that attended. 1 voted yes, 1 voted no, and 1 abstained.
And
So
no one.
it's a no vote. Yeah, so it just
That's
stayed the same.
interesting.
Yeah, yeah.
Every vote counts.
Yeah, I mean, it is true that usually the state only moves when the majority of towns and cities in the state
Oh, yeah,
have adopted something, and the state
yeah.
looks at it and say, what are we gonna do? Because, you know, now 2/3 of the towns have this ban and the state doesn't,
Well,
and the other third don't.
I mean, every law that every movement in tobacco control started locally, and it started like, are you kidding me? You know, this is the same way this is. And I'm curious I really am curious to see how it takes off. And if
Yeah.
there's people that are in or,
I thought it was interesting when it was held.
yeah.
I thought for sure that would have been knocked down when it went to court,
Yeah.
but when it was
Yeah.
held, I was like,
Yeah,
that's pretty
I
interesting.
mean, they even talk about the lawsuit, Six
Yeah.
Brothers versus Brookline.
Yeah.
Sterling has argued that it was unconstitutional, conflicted with the 2018 statewide law, changing the minimum age for purchase from 18 to 21, court rejected the arguments. State law expressly allows towns and cities, long considered local community laboratories for public health policies, to prohibit tobacco sales in full. The court ruled further, it ruled that Brookline's bylaw does not undercut state law, but rather augments it, and that the town has a legitimate interest in mitigating tobacco use overall, and particularly by minors.
We've had conversations around the the tobacco-free generation at the MHOA board meeting, so you have, maybe 30 health directors there sitting talking about it. And it's interesting to see how, the constant conversation around public health is how much do we regulate and how much do we allow people to make choices? And is it more about educating or regulating or, and it was a mixed bag on a lot of people, how they feel about the tobacco-free generation.
So I guess the only question before us is, do we want to attempt to do anything like this? If we do, can it be a regulation? It doesn't have to be a bylaw.
It can be a
Bylaw.
regulation.
Yeah.
Bylaw's got to go to town meeting.
Yeah,
And I would-
bylaws are good because you get more buy-in from the town.
And you've got to reverse the bylaw again through the town meeting,
Right,
Mhm.
whereas a regulation can be revoked.
if the board changes and the attitude changes with the new board, then yeah, they could just revote it and it could be gone. Whereas a bylaw has to go through town meeting again, yeah.
So I guess, it's gonna be the will of the Board of Health.
Right.
Do you want to join in this effort? Do you want to wait and see what happens at more towns? Do you not want to get involved with this? Because it will be controversial.
Oh, it will.
It will certainly be controversial.
Yeah, I mean, I'm happy to watch for a while, see where it goes without taking action with this board, but I'm just one of 5.
So what's the pleasure of the board? We just heard from Amy. Terry, what do you think, Dr. Reed?
I'm conflicted. I'm conflicted because, philosophically, I think we ought to go for it, but also realistically, no, it's gonna be a very hard won battle. And so I guess the middle ground would be to wait and see how many other people get on board with it. How many-
Yeah, I mean, yeah.
Yeah.
David, what's your feeling about what to do?
It probably won't surprise folks I am not in favor of this. I think that encouraging folks not to consume tobacco products is in the best interest of the citizens of Plymouth. I think us educating, I think us getting out there and sharing some of these statistics and really holding the retailers responsible as we have. I think that is a more appropriate role for the board. Philosophically, as folks know, I'm very much concerned with infringements upon individual liberty and folks' right to choose how they live. And so I wouldn't be in support of pursuing something this stringent. But I am 1 out of 5 of you, so.
Well, so far all we heard is let's wait and see, so.
Yeah.
See how much it spreads. Lorenzo, I mean, I know you want the Board of Health to take the lead in a lot of things. How do you feel about this?
Yeah, I mean, my personal position on this is that I was happy to see that Brookline took that and kind of, started paving the way for other towns to maybe take a lead and join a minority. But I think it's, from my standpoint, I would be supportive of it. The process by which it goes, I think I agree with the rest of my fellow members on the board that we should take this and be very specific and maybe have a forum and talk about it and have public comments and things around that. We don't have to take action, but you put it out there, and if there's sentiment around going down this kind of policy, which at least I'm one of five, as David would say, I would be, it wouldn't take too much to win me over to put some sort of regulation and limitation. I mean, the science around tobacco is settled, right? It's not good for you, and it's bad for the economy from a health perspective because of the adverse effects of tobacco use. So to me, it's settled business, and anytime we can get to zero use at some point happen is good for me from a public health standpoint.
Okay, thanks, Lloyd. Deb, do you have feelings about this also?
I'm trying to, yeah, so I'm not an advocate of smoking, but I do believe there'd be a lot of pushback on something like that. I mean, people are educated, and I guess, well, you'd assume people are educated, it's their choice, I guess, but yeah, you're gonna see a lot of pushback on it, I think.
Yeah, I mean, I would agree. So my feeling is, I would join the other board members that feel we should wait and see to see how quickly this kind of effort spreads. And we certainly should push forward with a, 1 day smoke out.
Yes, definitely.
Absolutely.
Yeah, I
we
think
need
that's
to
a
do
good
that
idea.
and-
Yeah.
And try to distribute if we have a way to provide, to obtain them, things that are, quit smoking aids
Mhm.
to anyone that would like to use them.
It's interesting for me to think about this, that 65 to 70 years from that date, those municipalities will not be allowed to sell any tobacco products within the municipality. It's interesting.
Yeah,
It's almost like when Rockport was a dry town and didn't sell alcohol. It was like you couldn't have alcohol in the town of Rockport. These towns you won't be able to have any tobacco products in those towns.
Well, there was wasn't it, was it Winchton? No, Westminster, they had a ban on tobacco sales. And then there was, an overthrow of it. I'm trying to remember if it was, because the board itself did it. And then I think there was a rebellion against it.
Pitchforks.
I have a cousin that lives there, and I remember her having strong opinions about the board overstepping their boundaries to prohibit smoking, and she doesn't, was more of a, like to David's point, the liberty kind of thing versus the health implications, but, yeah.
So I think also the Public Health Excellence Grant Collaborative, although they probably would not be well suited to support this kind of generational thing, they are well suited to put forth an effort to join in a smoke out for 1 day effort.
That's absolutely true. We have
And
funding.
I bet we could use grant money to buy
Yeah,
the. quick
That's fantastic.
smoke
I'll talk to Linda.
because, we're trying to find ways to spend money before the end of the fiscal year, so
Yeah,
we need to buy a bunch of those things.
I love it. I love it. We're gonna do it.
So that's the end of that topic. It was sort of interesting, I think. I wanted to then show you, this came to my attention actually because, as you probably know, I'm heavily involved in what's going on with Coltech and the handicap meeting. So there is a film called SOS, the San Onofre syndrome. And basically, it's about what happened out in a community in California. It's a legacy documentary, chronicles the community's victory over leaking reactors, only to confront a chilling reality that there's deadly radioactive waste stranded next to a rising sea. Sounded familiar. And also sounded familiar was that they're worried about temporary containers which will decay and lose structural integrity. They claim it's a nationwide crisis and the race to avert catastrophe becomes a stark countdown against time. And so I'm not legally allowed to show you this whole film. but if I succeed in doing this, I can show you the trailer.
Thanks, David.
So let's see if I can get this to work.
And I'm assuming this is a true story.
Yes.
Yeah, where is it, Barry? Where is that?
Oh, it's in California.
California.
I guess now to do this, I gotta stop screen share with one and screen share what's currently starting. So
Okay.
stop the share. And then I have to attempt to share something else, I guess. Yep, this. Sooner or later, I'm gonna master this.
You are, you're getting there.
So this is the trailer for this particular film. And Holtec was involved in this also.
Is this out already or is it coming out?
It's out.
Can we
Except
watch?
It's on YouTube, isn't it, the film? I think
It's on, yeah, it's,
I think it's on YouTube.
see if the volume comes up.
I don't hear it.
What's on mute?
No, you're muted.
Oh,
Maybe if I turn the volume up on this. It would be a shame if I can't get the volume up. This is when I need David sitting next to me.
yeah.
So let's see if I can find a way to do it. So far, I haven't found the.
Well, is it, can you hear it on your computer? Like, can you actually hear it?
Yeah,
There, I got it.
Okay, there we go.
No, you're gonna meet yourself.
Okay.
I hear something.
That's you.
That's me, I gotta mute myself. But if I mute myself, then I lose the
So
sound.
nothing, yeah.
You wanna try that, Dana, see if you can get it to work? Eek.
I know, like, it's like a nice place to visit.
I can't have no control over it. It's not.
So I guess you're gonna, for the moment, just get the video without the sound, unless you can figure out how to do it. But it is a lovely place. There's a beach directly adjacent to these power plants. You can actually see it. Holtec is involved in this, nuclear power plant also. And if, as this goes on a little further, you'll start to see the dry casks. There's a lot of discussions going on because it's a meeting sort of thing.
So they deactivated this.
They decommissioned it and they started to actually do exactly what Holtec is doing here. And they-
I have some video now.
Give up?
No, I can't even see the video.
I need to get rid of that now. I'll hold it.
Turn up volume.
Yay.
I got it.
And that's the scary part.
We got it.
There's no way in the world that we are gonna allow
Each canister contains more radiation, more cesium-137 than was released from the shore.
We don't want this nuclear waste buried at the beach, just above the water level, 100 feet from the ocean. Who thought of this? This is crazy.
There were gross errors on the part of the individual operator and the rigger. So what we have is a canister on 18 feet.
Sounds like we got two audios coming in for some reason.
Can you mute your actual laptop? Just the actual, not up here somewhere. Yeah.
Change their water.
It's playing twice somewhere, that's the problem, I think.
What did they say? Is this a?
No, this is this is.
Playing on the laptop, but we don't need to know.
Oh,
Let's see what happens if I just.
I know, I think that probably did that.
Well, the thing that I was amazed at when I read.
Anyway, I'm gonna stop the struggles.
The thing I was amazed at, and they just brought up.
It's weird.
You should try it. You know,
Okay.
when we read about the bill.
It's still going.
somehow you better, your computer.
Yeah, I don't think I can find a way to do that easily.
Go to your volume and just turn your volume down.
I think it's gonna.
No, it's picking up all of our conversations.
Yeah.
Is there a key up
The volume button.
That's what I think.
Which is. Yeah, how about this?
I probably should put something there.
Usually it's way over here on the right. Nope.
All the way down.
This is a little weird. Yeah, I don't want to leave the meeting. So I need to start the share. I think I did. You see what this is?
How did you turn it on?
I guess I have to do this.
Let's get rid of the video.
And then I'm gonna let Dana show the other slides.
Oh, yeah, that's
Because
good.
I-
That's good now. Yeah.
Which slides are we showing now?
Could be the one after that. Where is it? There's a slide that says, that you just saw that shows the SOS picture on the far right.
Screen first. That?
Yeah, that's the one. So go to the next one if you can.
I don't think the whole thing is on YouTube. I think only
The trailer.
Okay,
the trailer.
so, just go, I guess, can everybody see that text at least?
Yeah.
Yes.
Okay.
Yeah.
Okay, so that was filmed over 12 years ago. And it chronicles how Southern California residents came together to force the shutdown of an aging nuclear power plant, only to be confronted by the alarming reality about tons of nuclear waste left near a popular beach, only 100 feet from the rising sea that with radioactivity lasting millions of years, that menaces present and future generations. So this is a national problem because there's 55 nuclear reactors across the United States, of which Pilgrim is one. It spotlights the role of citizens, that what they must play to ensure public safety is their top priority, told largely through the eyes of the characters we witness, how they mobilize their communities and become experts on the issues and tactically wiser in the face of adversity. So this is a warning about what's going on with the other power plants in the country, each of which has its own tons of intensely radioactive waste in inadequate temporary containers that are putting their local communities and national security at grave risk. So you can try if you want to click on that other link at the bottom of this.
There was a different one on the slide before, underneath the SOS, it was like an Eventbrite, and I don't know if that was,
That was the one I tried to open, I think. See if anything happens. If you click on that and you click open in a new window.
Is that just a minute and 21? Yeah.
No volume, no, still no volume.
Okay, so that's just a trailer too. Okay, that was what I was wondering.
Yeah, so that isn't gonna work either, I guess.
Yeah. Don't
So,
try which
what I would suggest then is that, those who are interested in seeing that trailer, just use the links,
Mhm.
at home. Since we failed to correctly figure this one out. So the nuclear plant update is basically, that there are still handicap meetings once every 2 months. The next one is gonna be, I believe, the Monday before Memorial Day in May. They turned off the submersible heaters, at least during the warmer summer months. They may turn them back on again. There's a lot of people that are now trying to find a way to induce Holtec to actually put monitors, especially not only on the stack where stuff is being evaporated out of the building, but also on the walls of the reactor building and where people are working. And also where those dry casks, of which I believe there's 62, are located, which is about 300 feet away from Rocky Hill Road. So I was told by somebody from MHB that actually went down there that he went into it, apparently there's a circle where you turn around if you try to get into the nuclear plant. He got that far and he stopped and was looking, and within seconds, a truck showed up with a security guard and started interrogating him as why he was there and what was he doing and why was he taking pictures with his cell phone. And he explained it, and then he left, and he went down Rocky Hill Road and he stopped where he could see the dry casks, and nobody bothered him.
No, you can park there.
You can park there, which is kind of a worrisome sort of thing.
And they built some sort of a structure that looks like a wall, but it's not even that high.
It's not that high and it's not continuous.
Yeah,
Yeah,
Like
it's
you
not
can walk
easy to
through it.
walk through it.
Yeah.
Yeah.
and there are signs all over the place that say positively no trespassing, use of lethal force is allowed.
Yeah. The thing that I didn't realize, that came up when we were reading about the bill, and also they mentioned in the part of the show that we got to see, that those casts are designed to be temporary,
Yeah,
and they're using them as permanent. And we know that sitting on the ocean, they're gonna start to disintegrate if they're temporary. And the other thing is that the casts hold 1/3 the amount, each cast holds 1/3 the amount of radioactivity that was released at Chernobyl. So 3 casts would be the same amount as was released at Chernobyl, and we have 16.
no, we have 62.
Oh, 62. Even worse. So we have 30 times the amount.
So this whole thing is going to be discussed at the upcoming MAHB certification meeting on Saturday downtown.
Barry, there's a question from Mary.
Okay,
She asked, did the person walk up to the fence line where the casks are stored?
yes,
Yes.
and that's been done by a number of different people.
Wildlife do that all the time.
I wouldn't suggest doing it. But you know, it has been done by people that were involved in organized protests. It probably would eventually, I imagine, but I'm not sure that they have security cameras there. They certainly had one at the turnaround when you're trying to get down to the entrance road to the plant.
Yeah, isn't that trespassing?
Yes, and I believe some of the protesters were actually arrested for
That's right.
trespassing
Yeah.
when they went and did this some time ago. But anyway, so that's,
Barry, I have a question. So you had mentioned, people working to get, monitors
Mhm.
there. I mean, is that something the board can, like, they say, it seemed, when we were talking about the form, they say, oh, it seems okay, it's fine. Well, can we make them prove that it's okay? Like, can we say first, make sure, we wanna know it's okay first. We don't wanna have something awful happen and then you say, oops, I guess it wasn't okay. Like, is that, I think the board has that authority. I don't know how, if that's something that we would wanna look
Well, that's gonna
at.
come up at the Saturday meeting in Taunton.
They're gonna talk,
They're gonna be talking about Board of Health Authority for that.
for that specific thing.
Yes. But, you know, in the meantime, what has happened is that, at the last meeting, I specifically asked Holtec if they would consider installing monitor systems, and there are some that I found online that actually also detect tritium. And their response was, there is no real-time monitors that can detect tritium. End of discussion. So I went online and I found 6 manufacturers that manufacture monitors real-time that actually detect tritium and send, they can either be arranged to send electronic warnings if it exceeds a certain level. Or they routinely will just send real-time data as the system operates to a location. So that's coming up for discussion also on Saturday.
Excuse me.
So,
She also just said, I thought there are remote monitors inside the buildings. That is what's reported in the handicap meetings. What would the benefit be?
well, the monitors that are there at the moment, do not detect tritium. And tritium is the primary radionuclide that is being released from the water.
Barry, what are the monitors detecting?
They can detect things like radioactive manganese. There's a list of about 6 different radionuclides that they detect and they quantitate. And they supposedly do it once every 6 months or a year. And then eventually they're supposed to release the data back to the Nuclear Regulatory Commission.
And do they do that?
I think they have, but there's quite a long delay before the data gets released. And a number of people said, well, if there's going to be real-time monitoring, we want the data coming into the state and even better to the local authorities.
So if they're talking about it on Saturday, I'm assuming you're going on Saturday?
Oh, yeah.
Yeah. Would that be, I don't think that they tape them, do they? The MHB doesn't record their.
I don't think they record those talks. But I'm not sure.
But you would bring the information back to us.
Yeah, sure.
Just checking.
And
I'll be
so,
there for that.
so that's the update. Let's see how we're doing with time. 5 o'clock, we're doing well.
Yeah.
Karen, can you do the director's report?
Sure.
30 minutes.
So tonight, we're gonna start talking about the Cape Cod oral rabies vaccination project. It's happened before in Plymouth, but I think it's important to remind people that is indeed happening. It's regarding raccoon rabies in Massachusetts. It is a way to keep Cape Cod an area free of rabies by vaccinating many raccoons in towns surrounding the Cape Cod Canal. The current vaccination zone will cover the area from the Cape Cod Canal east to Barnstable, south to Falmouth. In addition, mainland Bourne and Sandwich, Plymouth, Wareham, and portions of Carver, Kingston, Middleborough, Rochester, Marion, and Lakeville will also receive baits. So how can free-ranging raccoons be vaccinated? The vaccine is contained in baits that have a strong fish smell, specifically attractive to raccoons and unpleasant to people. Raccoons that consume a vaccine bait unit are vaccinated against rabies. This type of vaccine is desirable because it can be distributed in the environment and is potentially self-administered by wildlife. Vaccine containing baits are distributed from cars along roadsides and wooded, brush covered and wetland areas where raccoons are likely to find and eat them. Bait will also be dropped by helicopters. Driveways, lawns, buildings, schools, and agricultural fields are avoided. Does the vaccine cause any ill effects? in wildlife, or actually, can you go back just for 1 second? I'm sorry, Dana. I should just tell you that, the way that those photographs that are on the first page, helicopter is one way that they drop them. That's what the bait station looks like, is the second photo. The actual sachet, which contains the vaccine, is the third photo. And then it's just a picture of someone driving in the car that also is dropping the baits off. So does the vaccine cause any ill effects in wildlife or pets? So doses of up to 75 times the amount of vaccine that's contained in those one bait will have to be fed to raccoons and dogs with no ill effects. So that's kind of cool, 75 of those.
Yeah, 75 times.
Yeah. However, dogs that eat several of the fish meal block baits may experience a temporary upset stomach. A number of dogs who have eaten the baits have reported since the beginning of our efforts, and no ill effects other than occasional upset stomach have been reported. The bait is eaten within 4 days, and then almost all the bait is gone in 1 week. If the baits are found and eaten, they will dissolve. If they're not found and eaten, they will dissolve, exposing the vaccine packet to sunlight and air and making the vaccine ineffective. What might happen if a person finds a bait or becomes exposed to the vaccine? The actual intact vaccine bait unit is safe for people to handle. The liquid vaccine is enclosed within a plastic packet that's sealed within the bait block. Each bait is labeled with a warning message that includes a number to call for information. If intact baits are found, they should be placed in brushy areas where people or pets are not likely to find it. Chewed baits should be picked up with a paper towel and disposed of in the trash. If a person in physically good condition has direct contact with or ingests the liquid vaccine, there should be no adverse health effects, except for the fact that you might want to ask them why they did that.
There could be some other issues.
Yeah, maybe something else going on there, but if a person in a compromised state of health is exposed, they should certainly reach out to the Massachusetts Department of Public Health, and the phone number is there.
Middle school boys.
Yes. Now, can I set these baits myself in my backyard? No. Oral rabies vaccine baits are not available for purchase for the general public. The distribution of the baits is a permitted activity through the Massachusetts Division of Fisheries and Wildlife. What do we do if we see sick or wildlife or are exposed to a rabid animal? Call your animal control officer or the police if you see sick wildlife. Do never handle wildlife. If you come into contact with wildlife, wash all wounds with soap and water thoroughly, and then contact your doctor or veterinarian, and always keep your pets up to date on their rabies vaccines. So, and there's some more, some phone numbers you can call and some websites that people can refer to for additional information. But every year around this time, when this does happen, we do get phone calls in the department from people who have either found them by walking along the road and they wonder what they are, or their dog comes up to them and they have one in their mouth and they're quite concerned. So it's important that we have the information readily available so people know. Yeah. So again,
I gotta turn it off again. I was trying to get it to work.
since we're at the end of April,
Can you?
okay,
Stop? No, it doesn't. Okay, I'll just leave it again.
May is Mental Health Month, and since we're approaching May, what the Children and Family Services is hoping that folks do for the month of May is light up green. Green is the color they've selected as the official color for mental health awareness, because green represents renewal, hope, and vitality. So they're encouraging both commercial properties and residential properties to perhaps find a green light bulb or something like that, so that we can support mental health during the month of May. And finally, I want to say a huge happy Administrative Assistance Day to Dana Burke. who is such an important member of our team in the public health office. We could not do what we do without her. And she definitely deserves a day of recognition. And, so I just want to take just a second to say thank you publicly to Dana for everything that she does to support both the department and the board.
Thank you.
Thank you.
Thank you, we really appreciate
It looks
that.
like Lorenzo has his hand. Oh, is he clapping? I think he's clapping. It's fantastic. That's all I
I
have.
didn't know you could clap the hands.
I was clapping. I was clapping.
Lorenzo, I love that. That is absolutely fantastic.
Thank you.
That is great.
Okay, Dana, if you go back to the screen share with all the slides for the PowerPoint.
For yours?
Yeah,
Chairperson's announcements.
I've got some stuff down there towards the end.
This one?
It's a little bit up from there, I guess, yeah. It's that one. Yep, that's it. So this is information about a film that's called The Invisible Shield, which is all about public health. It's in 4 episodes. It's on PBS. It was put together and is available on, the first 2 are available on PBS broadcasts. The last 2 you can only get with PBS app, because it's also available on streaming. If you go to the next slide down, you'll see what's on the 4 episodes. So I sent this to everybody, I think. And I also sent it to everybody in the Public Health Excellence Grant. I also sent it to the state DPH and to the Massachusetts Association of Health Boards.
Oh, there you go.
And I also sent it to my town manager, who happens to have an interest in public health. And I got replies both from him and also from the head of the Office of Local Regional Health saying, this is fantastic, thanks for sharing. So it takes a while to view these things. It said actually the episodes were 30 minutes, they're quite a bit longer. But it's historical and it goes back to what we all went through during the COVID pandemic. I don't think Dana was with the office at that time. I don't remember.
22. Yeah, no, yeah, it was me and Margaret.
But certainly Karen and Margaret
Yeah.
and I went through a lot.
Yeah.
And the Board of Health put in place, as most of you probably remember, a mask mandate for just, I think, 2.5 months. And the kind of blowback we got from that was just unbelievable. But
Yeah, I've watched the first 2 episodes also, I haven't got, but, the thing that I thought was interesting is that, all the blowback up from vaccines and vaccination, and nobody I'm pretty sure this is the one that talks about smallpox, right? And that- yeah, so they show pictures of people with smallpox and how deadly it was and how we were able to eradicate it. And I also just listened to a podcast about it, so I might be mixing the 2 together. But it's like people forget how important vaccines are because we live in a world where we are vaccinated. So when it comes up with the COVID vaccine and people say, well, and it's like, vaccines aren't bad, like, and.
Well, I don't think you have to look much further than measles.
Well, that's it.
I mean, now measles for folks who didn't want to vaccinate their children for whatever reason. And now we thought measles was gone forever and now measles is back.
Yep. It's,
So-
I mean, it's gotta be a whole population effort. It can't, I know that there's some people that say, well, my vaccine protects you. So sometimes you get vaccines and it doesn't take, but you try, and if people just actively don't get vaccines, then it's gonna spread the disease.
Yeah, it's interesting because it's interesting with smallpox.
Yeah.
And even like when I was younger and I was in public school, you got vaccinated, no one asked your parent.
Yeah.
No one said like, is this okay with you? You lined up in front of that school nurse and they said, roll up your sleeve. You didn't even know what you were getting,
Yeah.
but you did it.
Which isn't always the best
Yeah.
method, but it was also, there's gotta be some balance between everybody actively.
No one got measles, though.
Exactly, exactly. And it comes to public health education, like why are people so opposed to vaccines? How do we educate people rather than, versus public? I don't know what the right answer is. And is it that, like, people talk about polio? I mean, the polio vaccine, oh, I know, there was a podcast I listened to called Inoculation, Incubation, and it had smallpox, polio, different, MMR, those kinds of, viruses. That's why I'm mixing get so many infectious diseases in my head, but polio, like they said that when polio was at the height of, people would have to go in the summer to not go out and play because there would be a polio outbreak and everybody was afraid to get it. And we, of course, we need polio vaccines.
Yeah, and I can vouch from the military perspective, because I served in the reserves for 6 years. In basic training, they lined us up, and there were guys on your left and your right with air guns. And all you heard was pop, pop, pop.
You got a bunch of them at one time.
And I said,
yeah.
what is this one for? Oh, it's for yellow fever. Oh, okay.
Yeah, I don't want to get yellow fever. Go ahead, give me the vaccine. Like, that's the kind of stuff that I think we all, in public health, can agree on. Is that I don't want to get it. I don't want to spread it. But then there's people that say, oh, I won't get it. It's not spreading. And it's like, because we're taking these efforts, because we're making movements towards preventing the spread of disease. And that was, I look back on COVID and you think about the mask mandates and everything and doing the best we can to prevent spread. Yet now there's pushback of the people that were opposed to it saying, well, see, it didn't even help. And there's so much around.
It did, because if you look at the numbers of flu, you cannot deny that the numbers of flu during COVID years were drastically down, and now they went back up again. There's a direct correlation to the fact that people wore a mask. Or avoided large crowds too. That was also another huge thing.
That was a big one.
Yeah, that was the big
I
one.
think the problem that we see is the smallpox. You could see the disease on the skin and it looked disgusting. And even with chickenpox and even with measles, all of those things you could see.
Yeah.
You get to COVID, you can't see anything. I mean, people were dying, but you can see.
No,
that.
it's true. No one looked at you and said, oh my gosh, you have COVID, right? Yeah.
And so the philosophy about whether I need to have a vaccine or not was, well, I'm not gonna get it.
In Poland, you see these pictures of iron lungs.
Yeah.
Or people not being able
Because
to
people
walk.
couldn't breathe anymore without the systems.
That was all the Easter seal stuff.
So it's weird, if you looked at the opening thing about this invisible shield, and the bottom in print, it says, public health has probably saved your life and you didn't even know it.
I mean, that's like, of course, I mean, you can go anywhere from sanitation, like something as simple as the septic systems in Title V in the food safety. Oh, my goodness.
I think food safety is huge.
Nobody thinks about it.
Yeah.
And I know, I mean, you see the restaurant inspections drastically reduce the amount of violations. But you say, well, how much oversight do we need? Why do I have to go, like there is a need for people to go in and oversee to make sure everybody's doing what's right. And that's human behavior to kind of cut corners. I admit it myself, but you have to have this invisible shield in place. I mean, the inspections, that's not invisible. We're out there doing them. Everybody sees us, but then there's this backlash against public health and all the,
Well, I think with restaurants too, it's such a turnover of personnel that and that's why I think we go in there more than, at least twice a year, in some cases, whatever the situation is, 3 times a year, because the staff does turn over. So yeah, you might have trained your staff 100%, And then they all left, and now someone's not labeling food, or isn't quite sure about temperatures, or, and it's like, you have to we have to do that to protect our residents and our visitors.
And it's
And we
not
do that for a reason.
Yeah, it's not, and to the restaurant's point, it's not easy. You know,
No.
and we had one, I was dealing with one at work, constant violation. So many, and just constant, and then would say, well, gotta put so eventually the board decided that they needed to hire an outside contractor, and with that contractor, what she realized, her as a consultant, was that the top management was all for it, and everybody else underneath was not.
Mm.
So when this top management is out for the day.
Right,
everything-
the buy-in wasn't
That,
there.
and they've been working on that, and now you
Mhm.
can see the improvements, but,
Mhm.
poor top management. Cause and then, but it turns
Yeah,
into.
well, that's sort of like, we had an example here, I think you were definitely on the board, Dr. Poffin, when, we also had, a restaurant here where there's a language
Yeah,
situation,
yeah.
and we
yeah,
ordered them to hire a consultant that spoke their native language.
yeah,
So there would be nothing lost in translation.
right, I've had that, we've done that too,
Yeah.
I've seen.
And, signs will put in,
Yeah.
their native language that
Yeah.
could understand
Yeah,
in the kitchen and things
Yeah.
like that, so.
Even at our grant meeting yesterday.
Oh, yeah.
One of the health agents, one of the towns said, we got so tired of having to go back to the same restaurant over and over and over again, that we decided we're gonna fine them for if there was a third inspection required because they didn't correct things, they were gonna fine them.
well, yeah, I mean, in Mansfield, if you have to have a re-inspection, you have to pay a re-inspection fee because we contract with, an outside consultant to do the inspections, we have to pay them.
Yeah, we gotta do that.
And I
Yeah,
think
yeah.
that happens
I mean,
in
you just-
Plymouth.
It doesn't, we're gonna do that though.
Yeah,
Yeah.
it's not easy, I mean, there's nobody wants it, and.
Yeah,
But it's directly correlate, like, if you don't have any inspections, then, like, we didn't want to overcharge at the beginning to cover costs for people that are doing what they're supposed to. So you do what you're supposed to, and and it's, like, again, it's not an easy business, but there has to be some balance of oversight and some balance to get the department to be able to afford doing this as a service to us.
yeah, even if there's an improvement on, even if they go back and there's been an improvement, I wouldn't find them either. Do you know what I mean? Cause they've made strides.
Right.
It's the third time if
Yeah.
they like.
Ours is a fee, because we have to directly pay,
Yeah.
it's directly,
Mm.
to what the cost of us doing business.
It was the same thing with the underage sales of tobacco, same thing. You
Right.
tell people, well,
Curious how that's gonna go
you
now.
violated this once, so you've got information about how you're supposed to do this. And you don't come back again with another violation within 3 years, and sure enough, they do. And we asked the restaurant inspector, for the grant, the regional restaurant inspector, well, what's your experience? She goes to all 6 towns, well, 5 towns, because we have our own system here. And I said, well, how many are, operating properly and doing a good job? Said, about half, and the other half not. And of the half that are not, most of them are getting re-inspected. And, over and over and over again to try to correct it.
Did I tell you that I got gas in Manamet? Did I tell you that story? I stopped to get gas in Manamet. And, the man who was helping me got a phone call from his girlfriend. He's like, oh, she wants me to pick up some cigarettes on the way home for her. He's like, but I can't, because no one's selling them right now because they all got
Oh,
I'm like, really? That happened? Oh my goodness. Well, I hope they learned that lesson.
Yeah.
Like, really? Oh my goodness.
I know, and I think about how many sales were here, and then in Mansfield, we had, 4 out of 23, which is huge for what I've seen in the 8 years I've been there. Like, why? Like, and I wanna know, is it statewide, like, or just the 2 towns that I'm involved in, or is everybody, like, is it just?
That's a really good question, Amy. I don't know.
Yeah.
That's a really good question, though.
Well, I don't know if there's a way to find
Yeah.
out.
Yeah, let me find out, I guess Ace has joined us,
Yeah, she's been here the whole time.
she's been here the whole time,
Yeah.
so.
Yep.
Let's find out, Ace, could you unmute yourself, please? Just wanted to include you in the discussion, if you can unmute yourself. No. And we don't know who Mary Katz is.
She identified herself.
Yeah,
Just
yeah, she's, yeah, it's a
Just
present from the public,
curious.
yeah.
Okay. So in that case, I'll turn it over to Lauren. After all this, what is your impression about all this? All the controversies that we have and the efforts we're going through?
As far as the Brookline thing or just in
Yeah.
general?
It could be the Brookline thing, it can be the power plant, it could be, you know, I didn't mention yet, but there was also a report that came out recently, they talked about pandemics, and said, what's gonna be the next pandemic?
Ugh.
And the majority opinion is it's gonna be flu or influenza
We've
related.
been saying that for 100 years.
That's amazing.
And every time it comes up, it doesn't seem to be that bad. But now there's this one called H5N1.
H5N1, yeah,
And
Remember H1N1?
I do. Do you remember having to stand in line to get a vaccination and you had like, I remember like people were like close to panic to bring their kids in. Yeah, because you had to get two of them. And people were like, what do you mean you have to get two? I only, you had to get one.
And there are a couple of slides actually on there also about that. They found it in cattle that are dairy cattle.
Yeah,
And then they found fragments of the H5N1 genome in the milk.
oops.
And they made a point of saying, well, it's not dangerous to people because it's just fragments of the virus.
Well, okay,
Well, it's pasteurized, when it's
And it's
pasteurized.
pasteurized, yeah.
yeah,
That's what.
that's why you can't sell.
Yeah.
That's right.
But when people start hearing about this virus or that virus has been found in this animal and that animal, when it gets to be a mammalian species,
Mhm.
it's worrisome
Yeah.
because those things replicate rapidly and they mutate, and the next thing you know, they become more and more proficient in infecting people.
Genomes are public ours.
Yeah.
Mm.
So I'm curious about these, things that go under your mouth that have the nicotine. What were they? They were,
Pouches.
Pouches,
Pouches.
nicotine pouches.
do
Yeah.
kids use a lot of those?
I haven't seen them at school, but I work at a golf course and like
Oh.
the like younger, like 20 to 30, like almost all of them like have them with them.
Oh, they
Like,
do.
it's gross. Like they come in, they have like a whole like
So-
stack. It's crazy.
And do they swallow that stuff all day long? Or
I
do they
think,
Spit it like
I
a
think you
spittoon?
spit it out. 'Cause I think,
Yeah.
I think the pouch is like.
They spit out chewing
fabric.
tobacco,
They
because
spit out chewing tobacco.
I have a brother-in-law that is addicted to chewing tobacco, and he
So-
carries this cup around in his
Yep.
car, and it grosses me out totally.
Gross.
So I just wanted to mention about, having this under your tongue all day long and the chances of developing tongue cancer.
Yeah.
And if anyone wants a really nasty type of cancer, not that any of them are charming. that
Bladder
tongue-
cancer too.
tongue Cancer, not a good
Mhm.
thing to have.
Yeah.
So, unless
Mhm.
young people, sitting under your tongue for hours at a time.
Yeah.
So the Great American Smokeout does happen in November,
Okay,
but I'm thinking that we should do that, use our funds for fiscal year 2024. And maybe not call it like a tobacco smoke, yeah, tobacco free, not just cigarettes, but everything. Like a nicotine free day. So we'll do something a little different, but yeah,
I like that idea.
yeah,
I
like
th- I
everyone
think,
just
I
be,
think that we could probably purchase those quit smoking aids,
yep,
with the grant funds.
yeah, I think that'd be a great idea.
Especially if we show them that we're gonna use that for at least a one-day smoke out.
Yeah, I love it.
Kind of presentation.
Plymouth will be tobacco free on a certain day. Let's figure out what that date is.
And
Yeah.
the other question I had for you was public health in general. Do you, we're talking about how people don't appreciate public health, what we do. What do you think young people think about it? Do they even have a concept?
I don't think a lot of people have any concept. I didn't really know what public health meant until like the past year. But like I'll tell my friends, like, oh, I'm going to the Board of Health tonight. And I'm like, what does that even, like, what do they even do? Like most people have no idea. I mean, it's not anything we learn about in school, which is a big disservice.
I assume the conversation about the Board of Health, Public Health has come up in at least one of your classes.
Yeah.
Thanks to you.
Yes.
And I think
That's
Panther
good.
TV did a.
Yeah, we did a
Yeah,
special,
yeah, we did I went and got filmed there too, yeah, so that was.
But we know that the teacher in one of your classes gave credit for filling out that survey form.
Yeah, actually, right now with my biomed class, we're working on like a water testing lab. And so everyone got water from a different pond in Plymouth, and the results are terrifying. Pretty much every pond had E. coli,
Oh,
there's like
Oh,
ammonia
yeah.
nitrate. Most of them had a pH of like 4 or 5. But once we get the whole class data, we're gonna like put it on a map and bring it in.
Yeah,
It's
definitely.
I'm gonna go swimming this summer.
Well, let your class know though, that all public beaches
Yes.
on pond are tested by us. So we make sure that,
What do you test? Like, what's the parameters? Is it just bacteria or,
yes,
okay,
Yeah.
so pH and all the other.
pH.
yeah,
stuff?
no, because you want to close it for that, to be perfectly honest with you.
Mm.
On the other hand, another thing that's come up, because I wanted to mention some upcoming possible agenda items. First thing everyone should know is that there will be an epidemiologist joining us on May 1st. A real official epidemiologist. And we have lots of plans for her. I think she's probably gonna be
She has lots of energy.
enthusiastic because she's full of energy.
She really is.
The federal government, DEP, has reduced the minimum allowable, PFAS for at least 2 of the PFASs to 4 parts per trillion. So it used to be 20 and then it was 10 and now it's down to 4. The state of Massachusetts usually follows the federal lead. And the water supply in Plymouth, I believe, based upon what I heard from the water superintendent, is safe, even though 1 of the wells or 2 of the wells do have concentrations somewhat above that level. But he said, you gotta understand that all the wells, all the water from all the wells gets combined.
Yeah, I think the most recent report showed that, even with the new standard, that, all of our wells met it.
Oh, that's good.
Mhm,
Because there was 1 or 2 that didn't.
mhm, yeah,
At one point. The one that supplies the Pine Hills, last number I saw was a 6. Which is not above the old limit, but now it's above the
Yeah.
new limit. The other thing I wanted to, and I already have some stuff made up for it, which we'll talk about whenever we have time, is radon. I get very concerned about radon.
yeah, you've been talking about.
And I
that.
don't think a lot of people are aware of, it's invisible, you can't see it, you can't smell it, you can't taste it. But if it's in your home, it is a major cause of lung cancer. Probably second only to smoke.
Hmm.
And so I actually have pictures of the radon test kits, and you can also get radon in your drinking water. And there are test kits also that you can purchase, that actually detects radon in your drinking water supply. And it's a major issue that I think people are very unaware of. I never thought about it much, but then when I found out, I started looking at these maps about where radon was the biggest problem. It's a moderate risk in our area of the Commonwealth, but where I grew up in northeastern Massachusetts, it was in the red zone. And no one even heard of it.
Yeah.
What are these
You
radon?
know what, it's because of the granite, so the granite underneath the houses
Yeah.
is producing the radon, and that's why, like, in New Hampshire, it's an issue, because it's called
Oh.
granite state, so.
But we have
everything-
sand, so.
Yeah, so that's, so when you said northern,
That's interesting.
It's easy and inexpensive to test for.
yeah,
You can buy one of these kits for like $5 at the home stores.
Right.
You just put it out in your basement about a foot above the floor and you leave it there for a certain amount of time.
yeah,
You send it back to the laboratory and they send you back the number.
right, and it isn't about what the house is made of, it's what's underneath the house,
Yes,
yeah.
So what about the municipal water supply? You said it can be in our water.
Yeah,
Do they test for that?
they test for some radioactive compounds, I believe, in their annual test, required testing, but I don't think PFAS is one of them.
Oh, I know.
I mean,
Which means
radon, PFAS is tested, but radon is not, I
Yeah.
don't think.
Mhm.
Also radon can come from, breakdown of uranium. And people think, well, that's in power plants and nuclear weapons, but uranium is a naturally occurring compound. So I'll provide some information about that going forward. Anything else that you could think of, Lauren, that comes to mind?
What's happening at the high school?
We had a mock car crash yesterday, actually, about drunk driving.
Mhm.
Something good for other towns to model. The acting was very good.
So they recruited students to be
Yeah,
the
yeah.
accident victims with fake blood and everything?
Yeah, they had, all the theater kids be the actors, and they had the Plymouth police were there, a funeral home, some EMTs.
Oh,
And they all
wow.
like talked to us afterwards too. It was
Yeah.
really good though, I think people feel like, scared a lot of people, which it should.
That kind of thing usually gets people's attention.
Yeah, but that'd be something good to do at other schools, I
Mhm.
think.
I think I mentioned to some of the school personnel that in the event that the schools get more deeply involved and try to do anything related to public health, that I'm sure that members of the Board of Health would be more than willing to even show up at the school to moderate discussions, or even to serve as like problem sponsors.
Yeah.
So need to make that, I don't know if Ace is listening, but just didn't mute herself, but we need to make that, something that people are aware of, and that's one of the reasons that we find it so valuable to have students on the Board of Health meetings with us.
Yeah, I agree.
So, anything else, public comment? Yes, Mary, do you have anything you'd like to say to the Board of Health? You still listening? Just not. So, and therefore, there's no further business today, so unless someone wants to bring up new or old business,
I will make a motion to adjourn.
okay? Is there a second to the motion to adjourn?
Second.
I don't imagine there's discussion, so I'll just call the roll. Dr. Reed, yes or no?
Yes.
Amy, yes or no?
Yes.
David, I think he left us.
Yeah, he left us.
Lorenzo, yes or no?
Yes.
Myself, yes. Since David left, I guess that means that Deb can vote yes or no.
Yes.
So the motion to adjourn carries unanimously. The meeting is officially adjourned.